live on Instagram. Now let's try Facebook. We are live on Facebook and Instagram.
Hi guys!
Hi everybody, we are in the laser room with one of our laser specialists, Emily.
Hi!
And also our receptionist, Brooke.
Hi!
And Emily, take it away. Tell everybody what we're doing.
So we are doing IPL on the chest today, and so this is an area that we frequently treat. We can treat all areas of the body. As you know, we treat the face rather consistently, but we don't want you to ignore other areas of the body, especially the décolleté. So today we're going to treat Brooke's chest, and we're going to get rid of some of the sun damage that she has acquired over the summer. So we are going to go ahead and get started.
Do we need eye shields?
Yes, we're going to definitely get the eye shields. So they're in that drawer right there. Perfect. We're going to pop those on. Everyone needs eye protection. Perfect. I'm going to hand you these. Thank you. No, we won't mess up your mascara. You know you work here when you're worried about your mascara. Very good. All right. And then thank you so much. I'm going to put these on. Okay, so now that we have our proper eyewear on, we're going to go ahead and we're going to start. So Brooke, I'll have you turn to the left. Perfect.
Oh.
Yep, that's right.
So Emily, someone asked, is IPL good for rosacea? Is that the best treatment?
So IPL is good for rosacea. It can help with diffuse redness. I would say it's good in conjunction with topicals as well. If you're going to do it with IPL, you're going to be looking for an improvement, but because there is no cure for rosacea, you're going to just be looking for an improvement in your rosacea, but it's not going to clear it completely. And you're probably going to be looking at about 4 to 5 treatments total, and then you'll have to manage it yearly.
Someone said, is this like Ultherapy? I think they must have missed what we said we were doing.
This is not like Ultherapy, that's for skin tightening. This is going to target pigment in the skin. It's going to pull the sun damage to the surface, and then over the next for the face, it'll be 7 to 10 days, but we're working with the chest, so because the body, the skin cell exfoliation is so much slower, it'll take about 2 full weeks. Those coffee grounds will slough off, and then she'll be left with a much smoother, brighter, clearer appearance.
So many people are asking if it hurts. Brooke, what do you say?
No, actually, it doesn't hurt. I got this ball because I thought it was going to, but it's not bad at all.
And you numb the face, right?
We always numb the face, yes.
And then someone asked, can you do this on scarring?
We can treat very new surgical scars.
And does it get rid of long-standing redness on the chest from sun damage?
Yes, it can help with that, yes.
Okay, and then they said, how far down the chest do you go?
We usually go to about right where Brooke is, so like you can see right where, I would say like kind of where the décolleté kind of ends, where you know, you would maybe wear like a deep V-neck perhaps.
And then they said, when do you see the end results?
So you need to do an initial series of about 3 to 4 spaced 4 weeks apart for optimal results. And then, once you have those optimal results, then you'll go into maintenance. And just like you do your Botox, you should treat your IPLs just like you do with Botox. So that means quarterly treatments to maintain your results. And that's because we want you to do some pigment prevention, collagen stimulation, overall health of the skin, and it also gives you a really nice glow. People who do IPLs regularly, you can really tell because their skin looks amazing.
Oh, this is a good one. Someone said, can you achieve the same result with IPL as BBL? You want to explain that one?
Yes, so we actually use the term IPL But what we have is actually the Cyton BBL. So that's what I'm actually using. IPL is a brand of
BBL.
so Cyton is a brand of IPL. But the reason that we like the Cyton BBL over IPL is because the glass electrode of this crystal is cooled throughout, whereas with IPL, it's just cooled in the middle. So with the Cyton BBL that I'm using here, you get a much more uniform, much more even treatment for the patient, and it's just a lot better, and a lot, the results are a lot more optimal. So it really is like a nicer treatment for the patient, and a lot more comfortable.
Someone said, can you do this all over the body? What are the areas we treat?
That's a great question. So the other day I treated somebody's face, chest, full arms, back. I have treated full legs, neck. Really, anywhere you have freckles, we can treat it. So we can treat almost every area of the body. Some things to note are you cannot be on antibiotics with this treatment. They can make you very sensitive to light-based devices like this, so no antibiotics before the treatment, and no self-tanners as well. So a good time to do these treatments are during the winter months when sun exposure is at a minimum, so when you are your palest.
So how does skin tone affect this on the Fitzpatrick scale?
So obviously we're looking for a very distinct difference between your base skin color and the pigment that we want to treat. So the laser likes a very stark contrast between the base skin color and the pigment that we're looking for. So the paler you are, the easier the laser has in terms of seeking out the pigment that it wants to go after, such as the sun damage, the hyperpigmentation, the photoaging, etc. So people that have more melanin in their skin, for instance, are better candidates for things like peels and topicals and things like that, just simply because the laser just sees pigment and it doesn't understand the difference between your actual skin color and the pigment that we wanted to actually treat.
Someone asked if they work on those red dots or cherry spots.
We can actually, yes, those cherry angiomas, yes, we can go after those.
And then they said, do you recommend this even for very minor sun damage and skin tone evening?
I do recommend it because the laser does stimulate collagen, which is a huge benefit, and it evens out the skin tone and gives you just a much more smoother, brighter, clearer appearance. So even just doing 2 of them can really make a huge improvement in your overall skin tone and texture.
Would you say this is good for all ages?
Oh, absolutely. I have patients that do this that are 18 to 88. How are you doing, Brooke?
I'm good.
Comfortable?
Yeah.
Good.
Let's see. How many treatments do you need, and does it differ for the area?
So typically I always recommend anywhere from 3 to 4. It doesn't really differ for the area. I would say it may just depend on your baseline, how strong your freckles are to begin with, or how strong your sun damage is to begin with. That's the only area where it may differ just a little bit. That's the kind of thing that we would discuss at your consultation, but usually it's about 3 to 4. And again, we would space them about 3 weeks apart. And that's just for the initial series to get you all cleaned up. And then we would go into maintenance.
Can you do this with melasma? That's a good one.
Oh, that's an excellent question. So typically I do not recommend this treatment with melasma, because the things that aggravate melasma are heat and light. It gets exacerbated in the summer for a lot of people. And what is laser but heat and light? So unfortunately, if I were to treat someone with melasma with IPL, the bounce back effect would be 10 times worse. So in those situations with people that have melasma, I recommend doing something like the VI peel, which is on special today. It's an excellent peel, helps tremendously with pigmentation, and I recommend our Koji pads.
So they said, so this treatment is only to help color imperfection and pigment correction only.
That's correct, yes. So it helps with sun damage, hyperpigmentation, photo aging. It helps with diffuse redness in the skin, so the laser sees browns and reds. And then it also stimulates collagen. So it helps with evening out the skin tone. It brings all that pigment to the surface. It helps get rid of, some redness that you see, and then it really just helps with the tone of the overall skin, and helps with the overall complexion. It helps give you a nice, even tone.
And Brooke, you're still totally comfortable? People are asking again if it's painful.
No, I'm fine.
And Brooke numbs for Botox, by the way.
Why do you point to my business in here?
We should point that out. She numbs for Botox. So if Brooke is doing well, then this is not bad. I'm going to go ahead and I'm going to do Brooke's neck as well, because we want everything to be even.
Let's see what else we're getting. Can you wear makeup after this? Oh, that's a good question, the aftercare.
Great question. So yes, you can leave this treatment room and put on makeup immediately. There's no issues with that. So anything that rises to the surface in terms of a coffee ground or pepper-like flake on the face will exfoliate off in 7 to 10 days. Usually everything is coverable with makeup. So you absolutely can wear makeup starting immediately. For post-care instructions, there is no working out for the first 24 hours. So I always tell people, please don't leave my room and go to kickboxing, okay? No jacuzzi, saunas, or steam baths for the first 24 hours. You can shower and wash your face. Just use lukewarm water, not hot. And then for the first 3 days, I would refrain from using any acids on the skin, like glycolic, lactic, salicylic, or any retinols, just because we want to avoid any exfoliating acids on the skin for 3 days, just to give the skin a break. But after 3 days, you're fine to use whatever you'd like, and you're fine to start exfoliating. So you can use a washcloth, a Clarisonic, a scrub, anything once a day to kind of help those coffee grounds come up and off the surface of the skin. And your skin will feel a little bit like a mild sunburn after the treatment. Does it feel a little bit like that now, Brooke?
A little bit, yeah.
Yeah, so that's totally normal. So it feels a little bit like that during the treatment, and it'll feel a little bit like that after the treatment. So I will give you ice packs, and I do recommend icing for 15 on, 15 off for 1 hour.
And if you don't have visible sun damage, but you know that you've been in the sun and laid out, are you still a candidate for this most likely?
You can be a candidate. A lot of times we can pull dermal pigmentation, so pigment that's not even visible to the naked eye. And so a lot of times that will come out. So I always like to say that we'll get it before it gets you. So eventually that would come out, and so we're able to pull it before it comes out and you actually see it on your skin. Okay, Brooke, go ahead and turn to the left.
And then what is the gel that you're putting down? Someone asked what you were doing now.
Great question. So I'm using ultrasound gel all over Brooke, and that's because the actual crystal of the laser makes direct contact with Brooke's skin. So we use the ultrasound gel as a buffer to make sure that the actual crystal isn't making total direct contact with your skin without something in between. All right, here we go. And it's also very cooling, so it helps with that as well.
By removing this sun damage, does it have any effect on developing skin cancer?
No, another good question. So it doesn't affect skin cancer negatively or positively. So definitely make sure that you stay on top of your derm visits and see your derm for your yearly skin exams.
Will this help with any fine lines?
It's not going to be a substitute for Botox or fillers. So it will help with collagen in terms of giving your skin a smoother appearance, but in terms of fine lines, no, you'll still have to do things like Botox and fillers.
And then someone said, is there any peeling with this?
No peeling. So what you'll find is that the fragmented pigment that the laser is breaking up will just turn into these tiny little coffee grounds or pepper-like flakes. Go ahead and turn toward me, Brooke. Thank you. And then they'll just kind of slowly exfoliate off. So there's not going to be any peeling or anything. It's not going to be like a chemical peel.
See, how many treatments are done on average? Does the average person need?
I would say the average person needs 3.
3 treatments. Okay, let's see what else. Someone else asked about melasma. Would you mind explaining if you can get it with melasma?
Yes. So I would not recommend this treatment for melasma, just simply because what exacerbates melasma is heat and light. Usually it's much worse in the summer for a lot of people. And so what is laser? But laser is heat and light. So unfortunately, if I were to treat you with laser, it would make your melasma probably 10 times worse. So laser is not the answer for melasma. What I do recommend for melasma is the VI peel, which is on special today, and our Koji pads. Those are 2 very, very good options for people with melasma.
Someone said, I've been wanting to try IPL. Do you have to do continual treatments, or can you just do a couple and then just maintain your skin from there?
You can try. So what happens in the treatment room is the only thing that I can, the only thing that I can do is, treat you in the treatment room, and then I send you off, and then it is your job to maintain your skin with reapplying SPF, wearing a hat, staying in the shade, not tanning, practicing really good sun habits. But you can always repigment. So I advise at a bare minimum 2 IPLs a year just for maintenance. Most people do need a little cleanup.
And then how is the Fraxel laser different than IPL?
Fraxel is completely different. So with Fraxel, we're completely ablating the top layer of the skin. With IPL, we're actually not taking off the layers of the skin. We're bypassing the top layers of the skin, and we're reaching into the dermis and breaking up pigment. And then broken pigment is just rising to the surface and then slowly coming off. With Fraxel, we're actually just taking off top layers of the skin, and then we're working on those layers of the skin to really work on tone, texture, pore size, fine lines, wrinkles, things like that. It's more resurfacing. This is not resurfacing.
Got it. Okay.
They're 2 very different lasers.
And we are nearing the end of our live, so if we didn't answer any of your questions, we'll be posting this live so you can watch it at your own convenience, and hopefully we do answer your questions. If we still don't answer your questions, you are encouraged to please text us at 314-991-5438. And we have all of our receptionists on hand, ready to answer any questions you have about these treatments or the specials, how many you need, all of that good stuff. So we're good to sign out. Thank you, Emily.
Awesome. Thank you so much, guys.